Today, on this episode of The Crossover, we will be discussing obesity in America, how to lose weight and keep it off, with bariatric medicine expert and faculty member at the University of Miami, Dr. Michelle Pearlman. Find out how you can redefine your eating habits, reliably reduce body mass, and maintain a healthy lifestyle long term. Much more on this episode of The Crossover. Good afternoon, everyone. We're going to be talking with my good friend and colleague here, Dr. Michelle Pearlman. Hey, how you doing?
Take two.
Much better. Yeah, I think it was the AirPods were causing some issues. So, but anyway, I'm gonna go back. I'm gonna do a quick, just a quick introduction while everyone's logging on. Super excited to have my friend and colleague here, Dr. Michelle Pearlman, bariatric expert here at the University of Miami, faculty member in the Department of Medicine. As background, she's a board-certified gastroenterologist and obesity medicine specialist with a focus on nutrition, weight loss, and actually malnutrition as well. She uses the, quote, food is medicine approach with all her patients, and she's really educated the community throughout South Florida, talking about wellness, nutrition, diet, bariatrics, hepatology, and she's really played a major force here at the university when it comes to showing how people can diet, lose weight, and really keep it off. She's been featured in numerous local media, including TV, newspaper, radio appearances. She's also been in the Herald, been on Good Housekeeping, Florida Trends Magazine, NBC, and Inside South Florida. So here to discuss a very important topic, obesity in America, how to keep weight off, and how to lose weight initially. So again, thank you so much, Michelle. Great having you on the podcast.
Thank you for having me.
Awesome. So we'll just start with some basics for people who may not know how important of a problem this is. How big of a problem is obesity in the U.S.?
It's a huge problem. So obesity has become, unfortunately, the new normal, or just being overweight, where 2/3 of the population are classified as overweight or obesity, 1/3 are classified as obese. And what's even more alarming is that if you actually look at the prevalence of those who meet criteria for severe obesity, so those with a BMI over 40, that prevalence is actually going up. So despite all the medication, the procedures, the surgeries, the research we have, clearly what we're doing is just not working.
And, people a lot of times say, well, it's genetics, it's family, my parents were overweight, my brother's overweight. How much of obesity is genetics versus behavioral?
Genetics definitely plays a role, but I think what's equally and probably more important is our environment. So we can only blame our parents so much. And even though people may have a genetic predisposition, if what you're taught when you're growing up are quote unquote normal eating behaviors, or you are growing up and you're not playing outside, you're playing video games, we may blame the fact that our siblings are also struggling with their weight, but it may have little to do with genetics and actually our environment when how we're brought up and what we think are normal eating and exercise behaviors.
So what about people who are overweight and they want to lose weight? There's so many fad diets, so much, misinformation out there. Where should people go to get scientifically based, evidence-based medicine, nutrition advice? Should they all see experts like yourself?
I think part of the issue is we as healthcare providers have failed our patients. At University of Miami, a tertiary referral center, I get patients that see me who are in their 20s, 30s, 40s, 50s, upwards in their 80s, struggling with their weight for the majority of their life. And I am often the first person that's ever asked them, what are they putting in their coffee in the morning? It is such a simple question, but we often skip over what are they eating, what is their exercise, what is their stress, and we tell them, okay, you have high blood pressure. If you don't lose weight in 6 months, come back and we're going to have to start you on a medication. And then when patients come back and they don't lose the weight, we deem them a failure of lifestyle modification. When it wasn't their fault, it was actually our fault for not giving them the tools in order to succeed. And so that's really part of the issue. And so because we're not giving it to patients, patients are going to the internet. And although the internet has many important roles in the digital age, there's a lot of not curated information, and people are quote unquote hungry for nutrition information. So they go to social media influencers and a lot of people kind of making X, Y, and Z claims, which really don't have any scientific background. So long story short, there are good resources out there when it comes to nutrition. You really want to look for evidence-based type of recommendations. Try to find people, let's say, on social media that actually give you the data, and then you can read through it and decide whether or not it's going to work for you. But always keep in mind that not all data is good data. So particularly when it comes to nutrition, a lot of these studies are funded by some sort of, segment of the food industry. So some studies that say, you have to eat breakfast in the morning, well, they're funded by the dairy industry. So not all good data can be trusted.
Now, what about how nutrition changes over time, right? So someone can be a teenager or in their 20s and have no problem having 5 Big Macs a day. They stay lean. They learn improper behaviors. I think that's going to last. Then they get 30, they put on some weight. They're 40, they're obese, and by 50, they're dead with a heart attack. So how do we educate the youth on appropriate eating habits? Because they may think what they're doing is right because they're not noticing any effects, but they're going to feel it down the road.
Yeah, absolutely. And it all starts from when we're kids. And so we need to start from the parents. I mean, that's one of the reasons why I love what I do, because I get the mom or the dad into clinic, and if I can educate them on proper nutrition, then they can then teach their children. So I'm not a pediatrician, but I end up having an effect on the kids or whoever else is in the household. So I think we need to first educate the parents to then provide good food to their kids. And I get it all the time where, the mom or the dad comes to clinic and they say, I tend at 11 o'clock at night, I go into the pantry and I grab a bunch of chips. And I say, well, why do you have chips at home? Your home should be your safe place. And they say, oh, my kids need the chips. I said, your kids do not need the chips. Because if they learn from mom or dad that having chips at 11 o'clock at night while you're watching TV is normal, that's going to become normal eating for them. And one of the hardest parts about my job, it's not doing procedures. It's actually teaching grown adults that what we think are normal eating behaviors are actually making us very, very ill. And just as our body changes with time, if we get an infection or antibiotics, or we have stress, we have surgery, just as everything in our body changes with time, our nutrition has to be just as dynamic. So what you were able to get away with when you were 20, you just can't get away with when you're 60 and still feel the same.
So interesting. I mean, you're talking about what are let's say the 3 most common misconceptions that you see in your patients that they're like, oh, I do this, I thought that was fine. And you're like, absolutely not. That's a major contributor to your obesity. Give us your top 3.
Mm-hmm. So one of them, and I promised you I was going to bring props here. So in Miami in particular, people don't just have an Americano. They have their Cuban coffee. And when I ask them, well, what are you putting in there? They say, oh, nothing. But what they don't tell me is they go to the nearest coffee shop or bakery and there's already tons of packets of sugar and creamer and things in there. So people will add, either regular sugar or artificial sweeteners, and they may put, 5 packets or something in there. And so I'll ask them, okay, what are you putting in your coffee? And they'll say, oh, just a packet of sugar. But it's only 1 packet of sugar. Why does it really matter? Because we use these terms, if it fits within your macros, then who cares, right? I look at sugar as a drug because it is a drug. It affects the same reward centers in our brain as cocaine and heroin. We don't see billboards for cocaine and heroin, at least not in Miami, right?
Not yet.
People know that probably doing cocaine and heroin is probably not the healthiest hobby, but every block they go, they don't see a billboard or on commercials with it blasting in their face. Unfortunately, with sugar, we tell people cut out the added sugar, yet everywhere we go, there's a bakery, there's donuts, you name it, it's being slapped in our face. And so it becomes this inner turmoil with people. And so when people say it's just 1 packet of sugar, I rephrase it and I say, you're starting your day off in the morning like snorting crack cocaine, and then you're going to crave it the rest of the day. So it may be that your afternoon lull, where you tend to crave something sweet, you may actually have that craving because you started out with sugar first thing in the morning. So that's number 1, is it's not just because it fits within your macros does not mean it doesn't change your brain chemistry and then actually influence what you have the rest of the day. My other topic I wanted to bring up is fruit, right? So fruit is healthy. There's a lot of nutrients, but this is one serving of fruit. This is 3 servings of an apple. So if you say, oh, I just had, let's say, 3 fruits in the day, but you're not having this banana, you're having this banana, you may actually be having 9 servings of fruit. And although it's definitely healthier than ice cream, it's still a lot of natural sugar. And too much of a good thing can be a bad thing. And then I guess my last one would be sodium. I'm actually filming a video nutrition series on various health topics. And one of them is actually sodium. So getting a thing of like mixed nuts that has salt added to it versus just a small pack of plain almonds. A lot of people will, let's say they're trying to cut out the sugar, they're trying to cut out the fat. And so they'll add a bunch of salt to their food to help flavor it. And so they'll tell themselves, oh, it's calorie free. Why does it matter? It's flavoring my food so it's more palatable. But the issue is that all that salt on your food, when you go out to a restaurant, restaurants use excessive amounts of salt because it stimulates thirst. And that's how they make money, is you buying your drinks. So you end up then actually getting a ton more calories in the drinks you're getting when you're dining out. It increases the volume in your blood, increases high blood pressure, increased risk of stroke. So just because sodium is calorie free, you actually then hold on to a ton of water, increase your risk of comorbid conditions, and actually eat more. So those are my top 3.
That's super interesting. And I think that if you ask the average American, they probably do at least 2 of those 3 things. So it plays to your point that it's about education, starting early, learning as a kid, so that as an adult, you don't have this turmoil about, oh, I've always been eating chips at 10 p.m. or having my coffee with sugar. So I'm going to ask you a bunch of questions that I've thought were kind of poignant. You tell me, what your opinions are on that. A lot of people say that they skip breakfast. Is that a good move or a bad move?
So breakfast, if we break down the phrase, it's break the fast. So whenever you're breaking the fast, that's your quote unquote breakfast, whether it's at 7 a.m., noon, or 2 p.m., that's your breakfast. The dairy industry wants you to believe that you're at increased risk of malnutrition if you don't have breakfast. Why is that? Well, because that's when typically people have a lot of their yogurt or milk and cereal. But that's really not true. So as long as you have a strategy in making sure that you're eating nutrient dense foods throughout the day, whether you eat at 7 a.m. or noon, it doesn't really matter. Now, where it does matter is in particularly if you're on insulin or if you're on certain medications where you have to time eating with your medications, then that's definitely going to play a role. Or me as a gastroenterologist, if you suffer from really significant heartburn and you're doing intermittent fasting and have 2,000 calories at 10 o'clock at night, that's not going to work for you because then you're going to bed and you're going to have major reflux. So it really depends on what your time constraints are, what your schedule is, when you actually are hungry, and then just making better choices during that eating window.
So talking about fasting, because you mentioned that, a lot of hype about intermittent fasting really come into, I guess, kind of mainstream these days. You have dinner, let's say you finish dinner 8 o'clock, you don't eat the rest of the night, you skip breakfast, you only have water or coffee, no sugar in the morning, so you have 0 calories. And then your first meal of the day is lunch at noon. Is that a real diet technique or is that false hype?
It's a real diet technique. Now, whether or not it's significantly better when it comes to weight loss and maintaining weight loss compared to just typical calorie restriction is another story. We were hunter and gatherers many, many, many years ago. So we weren't eating in the middle of the night. I get people that tell me all the time, I'm doing intermittent fasting, I'm not eating after 7 and I have my first meal at 10. Well, presumably we shouldn't be eating when we're sleeping, right? I mean, that's not intermittent fasting. I mean, that's normal eating behavior for overall health. And so that's a big key there. But really, in general, intermittent fasting can be helpful because it actually reminds you what hunger feels like. We are trained from when we're kids that we're supposed to have breakfast, lunch, a snack and dinner, and maybe milk and cookies at night. And we don't even give our body and our brain a chance to actually recognize what does hunger actually feel like. I have patients that ask me, what does that feel like? So intermittent fasting can be helpful because you're more in tune with your body and say, okay, now I'm hungry, so I'm going to eat versus I'm going to eat just because I'm told to do so.
So interesting. And when you're talking about size of meals, let's just say you're aiming to have 2,000 calories per day. Is it better to have those 2,000 calories in two large meals or four small ones?
Yeah, this gets back to just the individual person. So if you've had, let's say, a gastric bypass and now you have a very small stomach pouch, then you absolutely need to spread out your meals because you're not going to be able to tolerate 1,000 calories in one meal. So if you've had some sort of intestinal surgery, then that's going to change significantly where you need to eat probably 4 times a day. But for the general person who has normal anatomy, if they want to eat 2 times a day or 4 times a day, it doesn't really matter. It's really just, again, asking ourselves, are we hungry? And when we're hungry, then we eat, but not eating to the point where we're so full that then we feel ill.
Now, what about hardcore Atkins? Good or bad?
Bad. Simple answer. We overdo protein. Protein is very important. It's the only macronutrient that our body absolutely needs. But there's a fine line between eating 60 or 80 grams of protein and 300 grams of protein, along with a ton of saturated and trans fats. So for the most part, and this gets kind of into the macronutrients as far as what our body requires, for most people, it's about 1 gram of protein per kilo of body weight. That's the typical person. If you're a bodybuilder or your body's under a lot of stress with sepsis or something, then you're going to need more. But in general, these keto diets just promote tons of fat and protein, more than our body actually needs.
What about carbs? How many do you need? What type? People will say complex carbs are okay, like a baked potato is good for you, but chips and rice and corn are not. Just, give us a little background. Carbs, what should we be eating?
Yeah, it's so funny. So if you look at the old food pyramid that was on every cereal box that I can remember growing up, the USDA actually recommended that people consume 6 to 11 servings of bread, rice, pasta, crackers per day. 6 to 11 servings.
That's a
So I
lot.
can't blame my patient when they say they have rice, beans, and a sandwich for every meal, right? Because we told them to do so. But of course, the USDA supports agriculture, and that's kind of where that came from, not actually from data. In general, the brain needs about 130 grams of carbs per day to function. Now, there are people that definitely go keto and get a whole lot less, but your body is able to turn, fat and protein. Through chemical processes, it's able to basically make it into a different fuel for your brain to use. But glucose is really the most efficient energy source. So sugar is not the devil. Carbs are not the enemy, but you want to get good carbs. So getting your carbs, let's say from, cauliflower. So veggies have carbs. People often assume that only bread, rice, and pasta have carbs. Cauliflower, vegetables, fruits have carbs. So in general, you want to get the majority of your carbohydrates from fruits, vegetables, and whole grains. And your whole grains are going to be things like oatmeal, brown rice, or whole grain pasta, things like that.
What about fats?
What about fats?
meaning, meaning a lot of people, again, going keto, going Atkins, will think that it's okay to eat a lot of fat as long as you're not eating a lot of carbs.
Yeah, it's horrendous. I have seen lipid profiles really skyrocket after people do the keto thing. There's definitely a healthier way to do it where you're getting most of your fats from, like nuts and salmon and hummus, avocado, things like that. But in general, it's very hard to do it the healthy way in a sustainable manner. So anyone can lose weight. Believe it or not, that is not the challenge. Anyone can lose weight pretty darn fast. The challenge lies in actually maintaining that weight loss. And that's why these fad diets just don't work. People lose a ton of weight. With that, they lose a ton of muscle. Then when they start reintroducing their old eating habits, they gain even more weight back because now their resting metabolism is slower because they now have sarcopenia from that muscle loss. So in general, you want to get your fats from things like nuts, seeds, wild caught fish. Those are really your best bet options, and really get rid of the bacon. I have people who literally will wrap everything in bacon and dump tons of cheese and lard in their food and tell themselves that it's actually healthy, and it's not. That goes also with these keto ice creams that have, almost 100% of your daily requirement, or not requirement, but what you're allowed to have of these saturated fats. linked with heart disease. It's not good. You may be, you know, a skinny person, but you'll probably be 6 feet underground sooner rather than later.
Yikes. What about protein bars, protein supplements? A lot of people will, you know, get up in the morning, have a protein shake, in the afternoon, have a protein bar. Are those supplements good or bad?
They're not great. The issue is they're basically candy bars with added protein. I used to eat them all the time, but they are full of a ton. They're full of a ton of artificial sweeteners or plant-based sweeteners. People who have GI symptoms often don't tolerate them because they have a ton of like soluble fiber to give it that kind of chewy texture, like the guar gums and things like that. And they're also just very calorie dense. So a lot of these protein bars may have 250 calories, 15 grams of fat, a ton of protein in there. They often constipate people, and a lot of artificial ingredients. So really, you know, it takes just as much time to choose a healthy snack that's less processed than it is to choose a more processed quick snack. So it took me literally 2 seconds to grab chips, and it took me the same 2 seconds to grab celery sticks, right? It took me literally 2 seconds to grab an apple, maybe 2 more seconds to wash it off than it would to have, let's say, a big thing of Nutella that has 30 grams of sugar. So time is not the limiting factor. And what's interesting with COVID is people used to tell me all the time, I don't have time to eat healthy. And then when COVID came and they were working from home and they all of a sudden had a lot more time, they realized that time was not the limiting factor. There was some other reason why they weren't putting in the time to make that healthier choice.
Are there any supplements at all that you would recommend the average adult consume?
No. The problem is, you know, the supplement industry is billions and billions of dollars. And the issue is that people are not eating nutrient dense foods. So they end up needing to supplement. So I see commercials all the time. There's one pill that says veggies and one pill that says fruit. And people are literally having their fruits and veggies in capsule form. That is not normal. When we were cavemen, we did not pulverize our food and put it in a capsule, and that was the way that we got nutrients. It's just not normal. So for the most part, we should not have to supplement good nutrition. There is no substitute for good nutrition, not just today, but every day.
Now, what about gluten-free diets? Again, a lot of hype. Let's say you have no problem with gluten and you can eat it, that's fine. Are there any benefits to still going gluten-free?
So a lot of my patients who are trying to lose weight, they inadvertently end up going gluten-free because they end up cutting out a lot of the pasta and the bread. The issue lies in people who choose the gluten-free bread versus the regular bread, or the gluten-free pasta versus the regular pasta. So the processed gluten-free foods are actually oftentimes more unhealthy than the similar option that contains gluten. Gluten is a protein, and it gives distensibility and elasticity to the product and makes it more palatable. No one's going to spend $10 on a loaf of cardboard. So what do? When you take out the gluten, they have to add something to make it more tasty and chewy. So they end up adding sugar and fat. So if you actually compare the macronutrients from gluten-free alternatives to the similar gluten-containing alternative, they're actually often worse and more expensive.
Interesting. What about water? Everyone says if you want to lose weight, just be drinking water all the time. What should the average adult be consuming in terms of water quantities?
It's so hard to say. It really just depends on, you know, what your body habitus is. If you live in Miami and it's summertime, you're going to have a lot of insensible losses through sweat. If you're very active, you're going to be losing a lot of water that way. In general, once you're thirsty, you're already dehydrated. So you want to start off the day drinking some water and then drinking throughout the day. Now, a lot of my patients, like I mentioned, I'm a gastroenterologist, suffer from GI issues. And so they will literally chug a ton of liquid at once. And when you chug a lot of liquid, you end up swallowing a ton of air, and then people start burping or they get really bloated. So instead of just chugging a gallon in one sitting, you want to drink throughout the day so that you don't feel that thirst. But also, people often confuse hunger for food with thirst. So if you feel like you're hungry, try to drink some water first, then sit back and say, well, was I actually hungry or was I just thirsty? And that can be very helpful.
How about our fruit juices for you?
Not good. Now, obviously, freshly squeezed orange juice would be a better option than something that has a lot of high fructose corn syrup. But let me ask you, Dr. Komatar, would you ever sit down and eat 4 medium-sized oranges in one sitting?
No.
For some reason, we think it's normal to squeeze 4 medium oranges and shovel that drink down our mouth in the morning along with our biscuits and gravy, and we think that's normal. It's not normal to consume that much sugar in one serving. And so if you're craving something citrusy or craving orange juice, then you just eat the orange, but you shouldn't be drinking the juice.
What about milk? I know that obviously people have said that it's great for kids. What about young adults, middle-aged?
Yeah, the USDA actually still recommends, if you look at like the my plate, there's always that little cup of milk actually in the picture. It's still in there. But it's kind of funny in that it's actually normal for us as humans to lose the ability to digest lactose. It's normal that we lose that lactase enzyme. So we consider disease to be lactose intolerant. That is actually normal. It's a genetic mutation for us to actually keep that enzyme in our small intestine as we get older, yet we consider it a disease. And so for the most part, we do not need cow's milk to get calcium. That's what the dairy industry wants us to believe. But a lot of these food products out there are fortified with vitamin D and calcium. You can get just as much or sometimes more calcium and vitamin D in an unsweetened almond milk as you can cow's milk.
Vegetarian, vegan diets. Let's just say you don't have any religious or health restrictions. Are they beneficial?
It depends on the person. I'm a huge promoter of whole food plant-based, but that does not mean you have to be a vegan or a vegetarian. I think most of our calories, when it comes from data looking at chronic disease and cancer and the cancer population, we know that whole foods are really the best bet. So like I mentioned, fruits, vegetables, whole grains, nuts, seeds, those are where we should be getting the majority of our calories. Now, if you have a lot of GI symptoms and you eat a bunch of broccoli, cauliflower, and garlic, you're probably going to feel awful because those foods are very gas promoting. But there's still ways to get good nutrients by eating a lot of vegetables. You just have to choose the right ones. So in general, I don't necessarily tell people they need to cut out all animal protein, but we often in America consume way too much. People don't just have 4 ounces of chicken. They have half of the rotisserie chicken, or they don't have just a small tenderloin. They have 16-ounce steak when they go out to dinner. So we just do it in excess is the problem.
How much red meat should someone consume? Let's say per week, per month. What's an acceptable amount of red meat?
Yeah, no one should necessarily consume red meat. I think if you're going to, I just tell people try to limit it as much as possible, but it depends on where people are starting from. So if someone typically has a steak every night, so 7 times a week on average, then I'm going to meet them where they are. I'm not going to say you can never have steak again. I'm going to give them a goal of, okay, why don't we try to cut back to having steak once per week and see how you do there. So it's not about completely eliminating food groups where people feel like they're being deprived. It's not about being perfect or making perfect choices. It's just about making better choices.
So let's just say, for anyone listening who wants to lose weight, in your opinion, what is the best diet? And is it simply calorie counting? Because, from my understanding, diets are basically ways that people can, within their lifestyle, reduce just have lower caloric intake. Is that all that dieting is basically calorie counting?
No, it's not. I mean, that's why I'm booked out 6 months in advance, because it's just not that simple. When I was in school, I was taught, calories in, as long as they are less than calories out, you're going to lose weight. It's just a numbers game. It is far more complicated. I mean, there are truly people who struggle with obesity. They, eat a carrot and they gain a pound, right? Or you have people who are naturally very thin. They can go to Golden Corral buffet every day of their life and not gain a pound. So the microbiome plays a huge role, our muscle mass, our environment, antibiotics, stress, all of these things play a role in weight gain and weight loss. It's not just about numbers. Now, if you're trying to lose weight, then being in a calorie deficit is very important, but that is not the name of the game. It's also about where you're getting your calories from.
So do you have a particular diet that you are a fan of, or is it literally is depending on the patient? Every single person is different, and there's no one particular diet that you're the biggest fan of?
Yeah, I try not to actually use the term diet, because then in people's minds, it kind of tells them, okay, it's a short-term thing. And in 30 days, like the whole 30, I'm going to lose a bunch of weight. Then I'm going to be able to eat what I was eating before, and I'm going to be able to maintain that weight loss. And that's not true. So it is a nutritional plan. And the best nutritional plan for you or for anyone is the one that's going to work for you long term, right? So if people, let's say, hate vegetables, I'm not going to tell them they need to eat vegetables with every meal of the day. They'll never see me again. They're not going to buy into the program because it's just not realistic. So it's about figuring out, what are you currently doing? And then how can we make minor adjustments over the long haul to, again, make better choices, but not perfect ones, and try to maintain a consistent weight loss of 1 to 2 pounds per week.
So just wrapping up here, because I know you're super busy. So for our listeners, people who are trying to lose weight and keep it off, 3 relatively easy tips that you give them for losing weight and keeping it off long term.
Make your home your safe place. So every time you walk by the pantry, if you know the chips and cookies are in there, it's going to become this inner turmoil with you. You should not have this junk at home. If you want the ice cream, you can have it, but that means you need to leave your home and go get it. You eat it outside of the home. You never bring the junk food back into your home. So tip number 1 is your home is your safe place. Tip number 2 is try to get comfortable feeling hungry. People get so uncomfortable. They are afraid that they're going to wake up hungry, and so they eat right before bed. It is okay to feel hungry. It is actually normal to feel hungry. But then make sure, my tip number 3 is have healthy options around. No one is going to do this for you, and no one's going to make it easy. And I know you know that even in healthcare, we are often some of the most unhealthy people, and we're surrounded by a very unhealthy environment. So no one's going to do it for you. Bring an apple to work, or bring a Greek yogurt to work, or have celery sticks. Or if you're rounding in the hospital, put a little packet of nuts in your little, pocket in your white coat. You need to advocate for yourself, because you are important enough to do it. And so you have to make your own health a priority. I can't stress it enough. Your health is your wealth. And you either invest in your wellness today, or you're going to invest in your sickness later.
Wow. I could talk to you forever. I'm going to wrap it up because I know you're super busy. I just feel like you have so much information, and, I think to be most beneficial, you really have to educate the youth, people that anywhere from 10 to 20 years old, because I feel like once people have adult eating habits, it's obviously not impossible to change, but it's much more difficult than educating people who are young adults. So anyway, I'd love to just kind of continue educating the youth. What you're saying makes total sense. And I think as long as we change people's understanding of what nutrition is, there's going to be downstream benefits when it comes to obesity and health. So again, thank you so much, Michelle. All of these episodes for all our listeners are going to be streaming on the crossover. Thank you so much, Michelle, and look forward to seeing you around the hospital. Have a wonderful weekend.
All right. Bye-bye.
Awesome.